Hello everyone, you're almost welcome for our show. This is Platform Africa, and I'll be your host for today. I'm called Happy Ongi, that's my name, and we are so lucky today that we shall be hosting two resource personnel that will be sharing with us the issues that are at hand and more precisely the influence of the outbreak of COVID-19. And we are so lucky that we have these resource persons and they're already online. And at some point, they will be chipping in as they will be telling us more details. I know there are lots of questions that are running in your mind concerning COVID-19. We shall go through the general perspectives. We shall look at the myths or the lies or the unproven information that we've been hearing running around. Also would like to look at the measures or the precautions that World Health Organization has put in place regarding uh, the, the, the situation at hand. And also, we would also want to look at the local people, their perspective, and how this has influenced their lives, how it has influenced their mental health. And so, welcome with me, Charlotte and David. They are our resource persons today that will be giving us guidance and lots of information concerning this. You're almost welcome, please.
Yeah, so it's such a pleasure to be here. My name is David Sun Kong. I'm the director of the Community Biotechnology Initiative at the MIT Media Lab. So I have almost 20 years of technical expertise in synthetic biology and biological engineering. I do want to say, though, I'm not a public health expert or a virologist or an immunologist or an epidemiologist. So I just want to put that disclaimer there, but I do have quite a bit of technical awareness in COVID-19 and also coronaviruses. And I've been studying and following the situation very closely for many weeks. So I'm very happy to be here and happy to help provide any thoughts or comments that may be helpful to the communities that are listening. So thank you so much for having me.
You're very welcome, and thank you both. I think already we know our resource persons, and so we shall not waste really much time. I want us to go straight to the discussion. The first thing that we shall have today is the question of what is COVID-19, and it's a question that I would like to address to David. What is COVID-19, and what are its symptoms? And also, we would like to know how is it so different from the normal flu? Yeah.
That's a great question. So COVID-19 is a respiratory disease. That's the technical name for the respiratory disease that's caused by a virus called SARS-CoV-2. So that's the technical name for the virus. And the virus is a coronavirus. So a coronavirus is a category of viruses. There's a number of them that your listeners may be aware of over the years. SARS, MERS, MERS, SARS, these are different outbreaks that have occurred relatively recently to humans. And these are all different types of coronaviruses. There are some coronaviruses that have very, very mild symptoms that are just like a cold. And so those are some examples of other coronaviruses. SARS-CoV-2, the pandemic that we're currently experiencing, part of why this particular coronavirus is been so deadly and has caused such a significant impact globally are because of the severity of the respiratory disease, which is COVID-19, and that particular disease again has a lethality rate that is still being measured, but is definitely more lethal than the flu, which is already a very significantly deadly disease. So I think there are a couple of factors that are contributing to the pandemic right now that are making it so widespread. Firstly, the COVID-19 and the virus itself is extremely contagious. So there are a number of studies now that have been looking at the way that the virus spreads in communities, and the primary way that the virus spreads is through droplets. When you cough or you sneeze, there are droplets that have particles that have the virus inside. And so if you're near somebody that coughs or sneezes, and then you breathe it in, or or the virus can basically enter into your body and cause an infection through the mucous membranes in your eyes, your nose, and your mouth. So you're hearing, I think, a guidance from the WHO and other organizations really strongly saying, do not touch your face.
Yeah.
The reason why you're not supposed to touch your face is if your hands touch a surface that has the virus on it, and then you touch your nose, your eyes, or your mouth, that's how you can initiate the transmission. If you stand very close to somebody that coughs or sneezes, then you can potentially get infection from the virus as well. Again, it's a respiratory illness, so breathing it in, having the virus particles enter through your nose, those are some of the major ways that you can get the infection. And again, it's a very severe disease. There's studies that have been showing that for the younger population, if you're below 20 years old, the mortality rates are very, very low. In the US, I think there's only been one death of a young person younger than 20. But for people that are basically older than 20, from 20 to 40, 40 to 60, and particularly from 60 to 80, the elderly population, the mortality rates are much higher. So it's a very deadly disease. And I think, we're obviously in a very historic moment experiencing this pandemic globally, with so many global economies that have been shutting down. So that's just some background.
Wow, that's very interesting, and thank you so much for the insight. There's still more questions that people are really asking themselves concerning this pandemic, because it's something that we were not prepared for. And I would like to ask you another question in line with that. We have been seeing, we've been having flu like cold before, but again, we would like to understand like what makes the coronavirus so big, such a threat to us than the normal
Yeah.
flu that we have. Yeah.
Yeah. So the reason is the seasonal flu. Part of what makes the seasonal flu much more manageable is that over many, many years, the population has developed immunity. So over time, if in your lifetime, you may have gotten the flu before. And so what happens when you get infected with a virus like the flu, and then you recover, your body's immune system produces these proteins called antibodies. Antibodies are basically like the helpers in your immune system that help to defeat a disease. And so after you recover, your body, your immune system knows how to create these antibodies that are specific to the flu, for example. So that way you can't get reinfected, because your body already has that protection. And so what happens in a large population or globally, because the flu has been circulating in the population for so long, there's widespread immunity inside the population. And then there's also flu vaccines. So we have a vaccine every single year, you can take it, and then that should offer you some protection against the various versions of the flu. So the flu, like COVID-19, is a virus, but that virus it mutates and changes, which is why each year you have a different flu shot. But because of the vaccine and because of the larger immunity in the population, the spread isn't as bad. And also we have many medications and treatments for the flu that have been studied over the years. So that's why the flu is a much more manageable disease. COVID-19 and SARS-CoV-2, the major problem is this is a brand new virus that humans have never seen before, ever. So when the outbreak first started in Wuhan, China, there are certain aspects of the disease that, again, I mentioned. It's incredibly infectious. You can spread you can spread the coronavirus without having symptoms. So right now, the studies are showing that you first can get symptoms on average around 5 or 6 days after infection. So let's say I was exposed to somebody that had COVID-19. I now have COVID-19. As soon as I'm infected, even during those 5 or 6 days before my symptoms appear, I can also be contagious and spread the disease. So that's called asymptomatic spread. Before I have symptoms, I'm now spreading the disease. And so that's one of the most challenging parts around containing this particular pandemic. There are a number of other types of viruses where the infection, the spread of the disease and your shedding of the virus and your infection happens after the symptoms. So once you have symptoms, oh, I can just stay at home and I'm not going to spread it. This coronavirus is so much more deadly because you can spread it without the symptoms. And again, the major issue is that because the humanity has never seen this virus before, we do not have a vaccine. We do not have medications. We don't know how to treat it. So all of these factors make this pandemic so different from the standard flu.
Yeah. Thank you so much, David. Yes, I know you're saying it's a very new virus. Yes, it's very new to us. But I would still like to ask that have there been any survivors, like people who have had it and then somehow they were treated and they have survived?
Yes. I think the total number of people right now, there's more than 300,000 people, I believe, that have been infected or have been confirmed to be infected with the virus. And yes, but tens of thousands of people have recovered. And the majority of people that ultimately get COVID-19 will recover. So again, the case, the mortality rate, it varies from country to country and region to region, depending upon how good the healthcare system is. But the mortality rate has been seen as low as 0.4%. So something like in Germany and in South Korea, the mortality rate is less than 1%. So you can have a very, very good recovery. And again, probably more than in the United States and in Europe, for example, something like 80% of people that get COVID-19 do not require hospitalization. So they can recover at home. And for young people in particular, children, many of them have very mild symptoms. And for them, it looks just like a cold. But for the young people that recover well, the problem is they're still vectors for the disease. They can spread it to other people. And so it's really the elderly, the immune compromised, people that have underlying conditions already. Those are the folks where the mortality rate is much higher, where hospitalization is required. And because it's a respiratory illness, you can have very, very severe impact.
Okay. Yeah, wow, that's really great to know. And then we would also want to understand, you had earlier on talked about the age bracket that coronavirus majorly does affect like a certain age limit. Like I would really want you to speak like to the people and let them know exactly what age bracket is more vulnerable to this virus. And also maybe you can also tell us what health conditions are more vulnerable to the virus. Thank you.
Yeah, so the studies so far are showing that the mortality rates increase significantly for the elderly. So those that are older than 60 years old, typically. So 60 to 80 is a very at risk, and then older than 80, again, is very at risk. And so some of the underlying conditions that have so far been linked to increased mortality are things like underlying respiratory illnesses. And just in general, folks that have any sort of immune system compromised situation, so if you've suffered from cancer before or other types of immune related diseases, that also can impact your ability to recover well from COVID-19. But this is, I should say too, even for young people in the United States, for example, we're seeing even for people that are 20 to 50, there still is a very high hospitalization rate. So something like 20% of people still require hospitalization. So, and what's happening, and you're seeing this if you've been following the news in Europe and also now increasingly in the United States, the issue is the healthcare systems, even in places like Italy or the United States that have reasonable healthcare systems, there are only so many hospital beds. And so because this is a new virus, And when the virus gets into a population that's never seen it before, you can see a dramatic spike in the number of cases. And so the major issue for any country is if you have a healthcare system with only so many beds. In the United States, we have less than 1 million hospital beds for the entire country, for example. Now, if you have 1,500,000 people that need hospitalization, then you don't have room for those people. You don't have treatment space. And again, in the United States, you have these around, say, 1 million hospital beds. The majority of those beds are already filled with patients. So you only have a capacity to take on a certain number of new people that could be sick. And COVID-19, because of the nature of the disease and because of its rapid spread, it's overwhelming healthcare systems. And that's what you're seeing in Italy. Italy's healthcare system has basically been on the brink of a flood of patients and not enough doctors, not enough hospital beds, not enough equipment to treat all of the patients that are coming in.
Yeah, yeah. Thank you so much. Then, the fact that this coronavirus is affecting everybody, I believe that in one way or the other, there is one thing that we are not really getting so much in the information that is spreading around. We do not know how it can affect the body. Like after somebody has had it, like what are some of the effects that the person can later on develop?
Yeah. So COVID-19, which is the disease, is a respiratory illness. So in the mild cases, there are many symptoms for the disease, actually. So, and it depends person to person which symptoms may be more relevant. The most common symptoms are a fever, a cough, and then shortness of breath, difficulty breathing. Those are the three most common symptoms. But then there's a number of other symptoms that people have also experienced. So a sore throat, body aches and fatigue. And also actually there's some evidence that there's gastrointestinal effects. So having severe diarrhea or stomach issues also can be shown. There's also some very strange effects like losing your sense of smell is another symptom that people have observed. But not everybody has all of the symptoms, and there are many symptoms, which is why it can be confusing to diagnose because it can look very similar to the flu or a cold. But those are some of the symptoms that can happen. And in the very severe cases, you can have acute damage to the lungs. And that's often how people are dying, is because of the damage to the lungs, which then can lead to other organ failure in the body. So really, it's primarily a respiratory issue. The other thing that's worth mentioning, there's an upper respiratory system with your mouth and your nose and your upper throat, and then your lungs, which is your lower respiratory system. Some of the early studies are showing that if the virus stays primarily in the upper respiratory system, then the symptoms are likely, and the disease is likely to be less severe. But if the virus penetrates down into your lungs, that's when the much more severe cases emerge.
Okay. All right. At this stage, I think you've really handled these questions very well, and I hope that our viewers have got enough of this, because these are some of the questions that have been going in our minds, and we really needed somebody with an experience of the health and to give us, what these things mean. So thank you so much. That's like our first step. And now we would also want to look at what I would call the myths or the lies, because there is a lot of information going around the world concerning coronavirus. And we would really like to hear your own perspective regarding some of these myths or lies that people really have believed in. We want to know whether they are real or it's just some kind of myth, like I've said already. And the first I would ask is that, is there any truth or news that COVID-19 can affect Black people? Because we've been hearing a lot as people say that the Blacks are not being affected in one way or the other. So we want to really understand it from the perspective of somebody who really knows health issues. Like, Is it true that it can't affect the Black people, or are there examples of stories that have proven about that? Yeah.
Yes, COVID-19 can infect any human on planet Earth. COVID-19, the coronavirus does not discriminate by country, by race, by gender, by political affiliation. Every single human on Earth is at risk to be infected by the coronavirus.
Okay, it's as simple as that. Okay, and then
Simple as that.
yes, yes, thank you. Was the coronavirus invented?
So all of the indications are that that SARS-CoV-2, this particular coronavirus, originated first in bats.
Okay.
So a number of these coronaviruses, they started, they circulate in other animals. So this particular one has circulated in the population of bats for I don't know how long, and then it's thought that the coronavirus then somehow jumped basically from the animal to a human. And we've seen this happen, for example, with the swine flu, which came from pig. That came often the source of these pandemics, and why they're have such a big impact, because humans have never experienced them before, and they normally circulate within a certain animal population, which is what happened here with SARS-CoV-2, with this particular coronavirus.
Yeah, yeah, that's well explained. And then still something that I think the Africans are believing, is it in a way that it's related to the climate conditions, like if there are some hot places or warm places, then maybe they're less affected, and the cold places are more affected. Is that something like that?
Yeah, that's a great question. So if we're lucky, that will be the case. And some of the initial studies are showing that temperature and humidity may have an effect on the spread of the virus.
Okay.
So for example, you're seeing very significant outbreak and pandemic within certain latitudes in the world. And so there is a thought that the temperature zone matters. And so certainly in the United States and Europe, people are hopeful that once the weather gets warmer and it's more humid out, that the spread of the virus will decrease. But just to be very clear, even though the spread could be decreased potentially, and I want to be very cautious, we still don't have the authoritative studies yet, it's still extremely dangerous for everyone, right? Even in Africa, if the weather is more hot and more humid, that may, so one of the hypotheses, for example, is that when you cough, if the air is very dry, it's easier for the virus particles to spread, right? But if it's very hot and humid out, then maybe me coughing in a hot and humid area versus me coughing someplace very dry, it just spreads less, right? So that may be true. Again, there's a lot of studies being conducted right now to test this, but it's still something that needs to be taken extremely seriously.
So we Africans should not be so happy that okay, now we've somehow survived it, so it's all just there. Anyhow, so then I would also like to understand, because there are lots of people who have gone to the market and bought for themselves garlic, if you know garlic, like a whole sack of garlic, because somehow they have been told that it can treat COVID-19. So I would like to know from you, does garlic have anything to do with the treatment for COVID-19?
So the short answer is I don't know. I think something that's very important to convey to your listeners is we do not know still very much about this virus. There are initial studies that are coming online, and we're developing more awareness more rapidly, I think, of any other disease in recent history. The entire research community around the world is focusing all of their energy on this one disease and this virus right now, so we're learning a lot. But in terms of effective treatments, we still need more time for studies to occur. So the World Health Organization just launched a global drug trial called Solidarity is the name of the trial. And they're looking at 4 different combinations of antiviral drugs that may have an impact on COVID-19. But the short answer is we don't know yet. There needs to be larger studies with many more people for us to have an idea. So if you do hear things like eat garlic or drink this or eat that, I would say it's very hard to say. I personally have not seen any studies that say garlic has an impact. But I will say that in general, anything you can do to stay healthy is important. So being able to exercise well, have a good night's sleep, hydration, drinking a lot of water, eating healthy foods, all of the standard things you would do to stay healthy are incredibly important right now. Your ability to, if you get COVID-19, your ability to have a better outcome is definitely related to your own immune system and how healthy you are.
Okay.
I don't know, but if garlic is a part of a very nutritious meal that you're eating, that's a good thing to do.
Yeah, yeah, sure. Thank you on that. And then would also like to know, is COVID an airborne kind of virus?
Yeah, so it's again the virus itself persists in these droplets, essentially these small particles. You know, when you sneeze or you cough, you can kind of see this little mist of that sprays, and so it exists there, and so it can stay though in the air. So usually it is hitting a surface, and so or if people cough on their hands and then they use their hands and they touch a surface, then the virus can stay there. And
Right
it's
now.
very, oh, and I should say too, this is actually important for your viewers. When you cough, you should never cough in your hands. Yeah, cough in your elbow. You should cough in your elbow. This is a very important one. The reason is because if you cough in your hands and you do have COVID-19, now it's all over your hands. And if you touch your face, very bad. If you touch, yeah, exactly. You need to get everybody to cough in your elbow.
Yeah.
Okay, very, very important. Cough in your elbow. Do not touch your face unless you've washed your hands very vigorously. Another thing to mention about the virus itself is a little particle that has some what's called RNA, which is very much like DNA, which is inside the particle, which has instructions for how to make more copies of itself. But the shell of the virus is a mixture of protein and lipid. So it's basically like fat. And so that's why soap is your best friend. Soap is extremely good at destroying these virus particles. The virus is actually, when it's outside of the body, it's very weak. It just needs to be disinfected. So alcohol, any standard cleaning solution will destroy the virus. But soap is extremely good, which is also why you're hearing recommendations to constantly wash your hands. Anytime you are touching a surface that you have not seen before or you don't know where it's been, washing your hands is very, very important. And always, always, always wash your hands before you touch your face. That's the biggest mode of transmission is you touched a surface that has some of the virus on it, and now you touch your face, then you get infected. Or if you're in a very cramped area and there are many people around you, and now somebody coughs, and then it circulates, and then you could get infected that way. So that's why you're also hearing about social distancing or maintaining 6 feet of separation, say 2 meters of separation between you and another person. It's thought to be okay because if they cough, then they're still far enough away from you that you wouldn't get infected.
I don't know if it's like our culture, but sometimes we really take things so lightly. Things that are supposed to be done, for your own self protection. Sometimes we take them so lightly. And from the things that I've seen from some of the preventions that I see World Health Organization coming with, I see they are very normal things that actually we should not even be fighting with. But right now, it's all like a struggle because we haven't really been making use of some of these things. The normal washing of hands with soap, people just wash their hands, or some people don't wash at all. And that being said, I would like to know, well, this is Africa, especially. We have certain places where people may not even afford soap. They may not afford sanitizers, and so in that case, what would they use? Is there by any chance that ash can be used, because we are talking about alcohol and stuff like that? So do you think that ash can be like an option for people who may not afford soap or sanitizers? I'm asking David.
Hmm.
Yes.
Unfortunately, I don't know. I don't know. I think one of the challenges for Africa, and I think for many parts of the world,
Yeah.
um, is, if you don't have access to good sanitation or good water or disinfectants like soap. I mean, even in the United States, I mean, it's crazy. You can't get an alcohol wipe, you can't get hand sanitizer. They're completely sold out everywhere in the United States and even in Europe. So the availability for these products is very, very scarce right now. Unfortunately, soap is a little bit easier to get in the United States, so that's a little bit more widely available. I think one of the areas that I hope the research community can, and the WHO and other types of public health organizations can help to try to figure out what could be solutions that could be used if you don't have access to soap or clean water. Unfortunately, I don't know the answer to that personally now, but I imagine there are some experts that are trying to study this and could hopefully provide those recommendations. So, but I do hope and think that the WHO will hopefully be increasingly providing more guidance and guidelines for countries and parts of the world that don't have as easy access to clean water and disinfectants.
Yeah. Well, that will be very helpful. Then we would also want to understand now the fact that this virus has everything to do with people's immunity. We have a category of people who are already vulnerable, like let's say the pregnant people or people who are asthmatic already, they're having a respiratory problems in there. So in this kind of a situation where it is about the immunity, like how can they best protect themselves?
Yeah, again, I think anything you can do just to stay healthy, right? Eating a very nutritious meals is very important. If you're able to, something that again, these are very preliminary studies, but vitamin C, for example, when people in Shanghai, this is a treatment that doctors were using often, where if you started to have symptoms of COVID, they would just give you a giant spike, a huge dose of vitamin C. So if you are, for example, able to have access to those types of vitamins, that's really good. But in general, I think, and this is true everywhere in the world, basic steps you can do just to make sure that you're both physically and, as Shar was saying, mentally healthy is very, very important. I know right now, for example, in Europe and in the United States, where we haven't had to deal with a pandemic like this in decades. Asia has had to deal with some of these pandemics more recently, or these different outbreaks more recently, and so mental health is a huge issue. I know for myself personally, even when several weeks ago, I was experiencing incredible anxiety around all of this, thinking about how to take care of my elderly mother, how to make sure my family is safe. Now that the infection is spreading so rapidly. And in the United States too, we are about to see our healthcare system pushed to the brink of collapse in the United States. New York City right now, in these hospitals, they're already full, and we're expecting tens of thousands of more patients that are going to rush into these hospitals. So if you get sick with anything right now in the United States, not even COVID, if you get something else, there's no hospital bed for you, right? So your ability to stay healthy during this time is really important. And I think the mental health part is so important. In the United States and in Europe, and also in parts of Asia where they've had these quarantines, we're being told to isolate ourselves. So we're literally sitting at home by ourselves, isolated. And if you only have your mobile phone, or you're looking at the internet and reading all of this terrible news, people are psychologically terribly impacted right now. And of course, your psychological health also impacts your physical health, right? I thought for 2 weeks ago, I thought that I had COVID-19. I thought I had some symptoms, and I started making myself go crazy, And when you start going mentally crazy, it makes your physical body less strong. So I had to just stop reading the news. I had to stop looking at the internet for a few days because I just couldn't handle it. So now I have a rule for myself where I only look at the internet and I only read the news if I personally feel both physically and mentally well, where I can handle looking at certain headlines. Because if you are suffering from that anxiety, that is one of the worst ways to impact your own health. So I really appreciate what Shar was saying earlier about making sure that you're really taking this time to be very, very mentally healthy. And a lot of that too goes back to support within your community. If you're able to do it, and again, this is very much a privilege, if you have an internet and you're able to use tools like Zoom, or if you can call your friend, or if you can FaceTime or do a video call, those are ways that we can still stay connected as humans, which is also why I value so much being here with you both here in Africa. I'm sitting here in Boston in the United States. Yeah, but I've actually been to Africa. I was in Ghana and that's where I met Jacksana, actually, was 2 years ago. So right now, I think it's a solidarity moment. All of us around the world, every single human being on Earth has to deal with this virus. And so we all need to come together as a big global family and support each other and care for each other and share those resources, share the awareness, share the knowledge when we can. And again, hopefully being able to share medicines and therapeutics and all the supplies as well. It's a moment for us all to come together everywhere around the world. So I really appreciate this forum that you're creating and this conversation we're having.
Yeah, very, very, very true. I believe that the mental health is very important. Actually, me personally, I am a victim of that. I think 2 days before, I felt all these symptoms, and I'm like, oh my God, I think I'm gone. And you know, the fact that you even just thinking of having it, that alone can demoralize you. You feel so depressed. You can't
Yes.
even tell somebody that actually you are going through this. And so I'm imagining our community, especially the refugees, they have already had this trauma that they're going through, and then something like this
Yes.
comes in their, you know, their community as well. And so I can imagine how it can be so heavy on them. And with that, I would really like to know, like, from your own understanding, what do you think this kind of pandemic, like, what does it have, what effects does it have with communities like the refugees? And you know, most of us, our communities, the refugees are more, they're having more sponsorship, like, from out. And so what do you think, like, it would be like for them?
Yeah, I mean, I'm not an expert on what the experience is in the refugee camps, but I can say that I think it's going to be very challenging, you know, which is very, very hard. If you're in situations where you don't have access to proper sanitation or easy access to disinfectants and so on, that obviously makes the situation much more challenging. The standard ways that people have been trying to mitigate and make the effects of the disease easier are things like isolation. If you're in a situation where you are physically closer to many more people, that makes the spread of the disease worse. So you may have read in the news earlier on, there were a few of these cruise ships, right? These giant boats in the ocean that have thousands of people on board, and the COVID-19, there was an outbreak on these cruise ships, and part of the reason why is because you have so many people in a very confined space together. Another place that there's been outbreaks in the United States is nursing homes. So, you know, where the elderly are all in one building together, and you have people that are serving food and so on to the same group. It can be very easy for the disease to spread in a very confined physical space. So I think, again, I'm not an expert on the refugee camp experience, but I think those are definitely going to be significant challenges. And if there are ways to try and create more physical space, I don't know if that's possible, but that will help. If there's ability to isolate yourself, that will also help. Something that has been shown in studies so far everywhere in the world, you know, we saw this in China, in Italy, throughout the United States as well. The spread often occurs mostly in households. So if you live in a house with, you know, 5 people, with your family, your kids, and your grandmother, and so on, this is often what happens is the spread will occur within a household, because in a household, you have much more closer physical interaction. You're touching the same surfaces, you're touching the same door handles and the sink and everything else. And so all of those modes of transmission of coughing and somebody breathes it, or you touch a surface that somebody else touches, that happens way more easily when you have a confined physical environment. So I think anything that can be done to help and create a little bit more physical separation when an outbreak does occur will be really, really important.
Really been deep, like you really brought it out so well. And I think what David also said at some point was very essential, because he mentioned about the news coming in from the TV, social media, and it's just too much. But sometimes I think you just cool yourself out and like, no, today I'm not checking news. Today I'm not going on social media. Today I'm just, let me be me, because the more you keep seeing, it's good to be updated, yes, like to get the updates on things that are going on. But I also think for your own mental health, you also need to see how you can put restrictions, because these are the things that we are the ones who get ourselves into. So it's social media, you can put restrictions that I'm getting in, or I'm giving myself some time. And also I would think that our viewers right now, let it not be a big deal for you to think that every time I need to be on social media, because the information on social media is going so viral to the extent that there are even very fake information going on. And if you look at it and you believe in it, before you know it, you start developing the fever, and you think that, okay, now it's here for me. And so yeah, I would really encourage everyone that please give yourself some space. And I really would also want to have this as we conclude. Yes, we are talking about self quarantine, and so I would like to know, like, if you're in self quarantine, what are some of the best things that you should be doing?
Okay.
Okay, let me contribute on
So
that. So
self-quarantine comes with a
self-quarantine
lot of
comes with
change.
a lot of
I
change.
think most of us
I
are
think
even being
most of
forced
us are even being forced
to work from
to
home.
work from home.
You're not used to the
You're
normal
not used to
office
the normal
noise,
office
or the bike
or the
noises, or
bike
the car
noises or
noises
the car
going to work,
noises
because
going to work,
noises are
because noises
distracting
are
for our
distracting
mental
for our
health.
mental health.
So one of the
So one
major
of the
things
major
to take
things
care
to take
of
care of
currently in
currently in
self-isolation
self-isolation
is your
is
activities.
your activities.
It's important to keep
It's
yourself
important to keep
active.
yourself active.
Either keep yourself
Either
active
keep
or
yourself
sleep.
active or sleep.
There's some of us who are
There's some of
indoors
us
and
who are
love
indoors and
sleeping.
love
If
sleeping.
that's your best
If
thing to
that's your
do
best
while
thing to do
indoors,
while
please
indoors,
sleep.
please
Good
sleep.
night.
Good
See
night.
you when
See you
COVID
when
is
COVID is
dealt with.
dealt with.
But for those
But
who
for those
are
who are
busybodies who cannot
busybodies
just
who
sit in
cannot
one
just
place
sit
for
in
too
one place
long,
for too
45
long,
minutes, you want
45
the
minutes,
next
you
thing, you
want the
want the
next thing,
next
you want
thing.
the next thing.
There's a very
There's a
big
very
guide of
big guide of
online
online
online board
online
games
board games
for those who
for
play
those who
chess,
play
for those who
chess,
play
for those who play
solitaire, that's
solitaire,
cards,
that's
for those who
cards, for those who
play
play
any kind of
any kind of
games, they're
games. They're
online. If you
online.
have the
If you
space
have
to
the
download
space to download
an online
an
game, a
online game,
safe
a safe
online game,
online,
allow yourself
allow
that chance.
yourself that chance.
But also,
But also,
there are books.
there are books.
It's actually
It's
way better
actually
in
way
this
better
time
in
to
this
read a
time
book.
to read a book.
Take this time to
Take this time
educate
to
yourself.
educate
Reading books
yourself.
is such a
Reading
nice
books
way
is
to
such a
educate
nice way to
yourself.
educate yourself.
And I
And
think that
I
even
think that
books
even books
on
on
dynamics, if you're the
dynamics,
kind of
if you're
person
the
who's
kind of
interested
person
in
who's
knowing the
interested
history
in
of how
knowing the history of
pandemics
how
came
pandemics
about,
came to this,
how Asia
how
has been
Asia
able to
has been
deal with
able
the
to deal
many
with the
pandemics
many
that
pandemics
have come
that have
over the
come
years.
over the
There are
years.
stories
There are
about
stories about
Africa and
Africa
dealing
and
with the
dealing with
pandemic
the
over the
pandemic
years.
over the
You
years.
can read
You
books
can
like
read
that, but
books
they're
like that,
still
but they're still
encouraging books,
encouraging books,
inspirational books,
inspirational books,
storytelling books.
storytelling books.
So it is a
So it
nice
is a
thing to
nice thing
read,
to read,
but
but
also
also
this is the
this is
perfect
a
time for
perfect
all
time
those
for
people
all
who've
those
been
people who've been
singing.
singing.
My
My
resolution this year
resolution
is
this
to
year
work
is to
out.
work out.
Perfect timing to
Perfect
work
timing to
out.
work out.
So
So
just yeah, working
yeah,
out is
working out is
simple.
simple.
Pick a
Pick a
simple
simple
activity. If
activity.
you
If
haven't
you
bought a
haven't
rope
bought a
yet
rope yet
and you're not
and you're not
completely in
completely in
lockdown,
lockdown,
I just want to echo everything Charlotte just said. I love everything you said. This
Yeah.
right now, yeah, just, you know, being able to have like a positive frame of mind, being real, remind yourself that you're healthy, that you're strong, that you're being able to stay calm and peaceful is so important. Something that I've gotten better at over the past couple of weeks, even, there's a playlist of just very soothing music that I play all day. I don't have the TV on to the news. I only look at the news like later in the evening at a certain time. But during the day when I'm trying to do my work, I just have very, very soothing music on in the background. First thing I do when I wake up in the morning is I exercise. I go and I do 30 push-ups, I do 30 sit-ups, and I try to get my heart pumping and make sure that I'm very physically fit. I've been eating a lot better, and now that I'm taking it more easy, I'm sleeping better, and having a very strong sense of peace and of calm is so important. And just like Shar was saying, now is the time. If you want to pursue your hobbies, your craft, your music, it's so great. If you are in a place where you can get outside and go for a walk, go for a bike ride, all of those things are super, super great right now. And I think the other important thing, just for everybody to remember, this too shall pass. This is not forever. This is not forever. It's a period of time that we're going to have to go through, and it's going to be, at times it will be difficult, but this is not forever. This is a moment in time that we have to get through, and then we will as humans move on, right? We've been through many outbreaks and many types of diseases like this, and this will pass. Right now, as we speak, there are so many amazing treatments and diagnostics and the vaccines being developed. So all of this stuff is coming. So it feels very challenging right now, and it is. And there are a lot of people suffering and going through a lot of distress, but it will pass. And so stay healthy, stay happy, support one another. I think these are all of the big things that we can do right now. So Shar, thank you for sharing all of those things, because I was taking notes too. I was like, oh yeah, I need to be playing my instrument more too. So
I'm
so
glad.
thank you.
I'm glad. Please.
Yeah,
Also
such great
add
advice.
one more thing. If you are
a blogger, poet,
an
an
artist
artist
of any kind,
that is art of any kind, music, drawing,
the world
needs
more
more right now.
and we have
We
Yes.
have the internet.
and
Yes.
I think over history,
the books you read, artists
or poets or
people
people who stand up and
and
inspire others have been the reason the world
goes on.
So for
So for
anyone out there who does videos of any kind, music of any kind, and you
Yes.
use the internet as your platform to do these things, this is the
time to do it more.
Blog more positive blogs, more positivity blogs. There's
Yes.
so much you can do with the internet right now to inspire people, to allow them to see the purpose of this time and be there for each other. We need each other
right now.
That's
Yes.
the most we can
We
have. We
need our virtual
others right
right now.
Yes, Shar, preach.
Yes.
Preach,
We're having a Sunday
Sunday
sermon now that we can't
go to church.
This is where we'll be having church.
Okay. Yeah, I think I really agree with both of you. Whatever you guys have said is just on point. And I think at this point, I really want to thank you so much for sparing your time and, giving us this source of information. It's been so rich. There are a number of things that we've just learned just during this moment of the interviews, and it has been so helpful. And I believe that our people have been following up, and I know that they will pick up with these things. So just to echo more on what you guys have said, everyone out there, please wash your hands with soap and more oftenly. Avoid coming into contact with people. If you're coughing, don't cough in your hand, but cough, yeah. And then if you're in self-quarantine or something like that, enjoy yourself, okay? Stay away from social media, or if you be there, know what kind of news to access, know what kind of information to access, and do your things like everyone has already said. Do the hobbies that you have, all this time you've been working and you didn't have time to do them, but now you have all the time. And above all, like David said, this thing will come to pass. Everything has a beginning and has got its end, and we can't deny the fact that God is seeing us in this situation. And so whatever it is that we are going through right now, let's know that there is somebody who is on our side, and we know that at one point it will be history. And so I want to thank you so much for your time. It has been worth it, and I know that there's a lot we've learned, just like I've said. And yeah, just a few words for the viewers before we can actually finish from David and Charlotte.
David?
Thank you so much. Yeah, it's just a real thrill to be here. And then so much love to anybody that's listening right now, to all of the family in Africa. We all are one global family right now. So thank you all so much for this platform. And hopefully we can talk again too as well. I'm really happy to engage with you more. So thank you all so much. A really pleasure to be here. Thank you.
It was a real pleasure to be here. It was amazing finally David Kong. JJ has been saying so much about And as Platform Africa, we're very glad we have this platform to do this. So thank you so much, Happy. Thank you so much, Kong. This has been very educative. This has been very eye-opening. I am officially at least 12% more educated about COVID-19 than I was about 2 hours ago.
Yeah.
And let's keep this up. Let's use all our platforms to continue sharing the right information about this time. And we are all with God. We've got each other. So whether it's medicine, whether it's mental health, whether it's water, whether it's vitamins, whether it's not shaking hands, whether it's self-quarantine, we are all with God. And I will take us back to Michael Jackson's song. We are the world, yeah? So let's listen to that song because that's the most we need right now.
Yeah, it's a wrap for today. Yeah, unless anybody has anything itching, but I think
Take the hug.
yeah. Thank you so much, David and Kong, for honoring this invitation. And thank you, everyone. Everyone has been listening to us. I hope you've learned a lot. And just like I've already said, this is not the first time we're doing this, and it's not the last. So we shall be coming back once in a while to give you more information, education on things that are concerning this outbreak. Thank you so much for your time. See you again. Yeah.
Bye. Thank you.
You're welcome.
Bye.